One of the biggest questions that the patients have when they come to my office is, if I need colon or rectal surgery, do I need a colostomy bag? And the answer is overwhelmingly no. There are certain cases where we do a planned temporary bag for certain types of cancers, depending on where they're located in the bowel. But most of the time, we're actually able to put the intestine back together again at the same time and avoid a colostomy bag. A colostomy is where the colon is sutured to the skin and your stool exits out into a bag rather than coming out the anus. And a lot of times this can be very distressing for someone who isn't used to this. So we have an enterostomal therapist who is a nurse who specializes in colostomy care, that if it's a planned colostomy, can see our patients before surgery and give them education and expectations regarding the colostomy, and can see the patients afterward to help them through this major life change. In many cases, these bags are temporary. Most of the time, we're not removing the entire colon and rectum. We're removing a portion of the bowel. Many times, it will self-regulate given enough time. So I always counsel my patients to say, it may be a little abnormal in the beginning, but there are definitely things we can do to mitigate that. Some of the things we can do to help with bowel function after surgery is dietary related and medication related. So we usually give patients several weeks to regulate on their own, and if they need more help afterward, we can certainly address that in the office. After colon and rectal surgery, there may be a time period where bowel habits are irregular. Again, this is something that's explained to patients before they have their surgery so they know what to expect, and this doesn't worry them afterward. We also have close follow-up with our patients after surgery so that if any concerns do arise, we can address them quickly. Usually these problems are self-limited and your bowel function will regulate over time.